We interrupt this program for breaking news from the Global National Newsroom.
Hello, thanks for joining us on TV and on our online platforms. I'm Robin Gill. We're waiting for Prime Minister Justin Trudeau to address Canadians. Physical distancing and staying at home have become the new reality during this pandemic. It's a collective effort to reduce our exposure to COVID-19. More than 1,300 people in Canada have died of COVID-19, and the number of confirmed cases has now surpassed 31,000. Today, Ontario is reporting 485 new COVID-19 cases, putting that province at more than 10,000 cases. Updates will be coming in from across the country in the next few hours, but yesterday, Quebec reported 941 new confirmed cases. Alberta had 239 new ones, and BC had only 43 new cases. Let's bring in Mike Drolet in Toronto. Mike, Ontario and Quebec have the highest number of cases, and Ontario just today going over more than 10,000 cases. That's a very significant number. Where is testing at for Canada's biggest province?
Well, testing is really the bane of Premier Doug Ford's existence right now. He's frustrated because the capacity is at 16,000 a day, and yet on Thursday they only tested just over 9,000. He wants more. So he has expanded the priority testing now to include people who work with the vulnerable. So that's essential workers, cross-border workers, people living with healthcare workers, which is new, care providers, and first responders. And so he wants them to be tested as soon as possible if they develop symptoms. They're still saying that people who are asymptomatic do not have to be tested, but the idea then is just to be able to test as many people as they possibly can who work in these areas that are especially vulnerable, and that way we can hopefully flatten the curve a little bit, which, by the way, they have said that the growth has slowed down here in Ontario, even though almost a third of all the cases in Canada are in Ontario, and they are expecting the peak very soon.
Okay. Yesterday, Quebec Premier Francois Legault said he wishes he had done more to get on top of the outbreaks at long-term care homes. He sounded so regretful. Mike, yesterday, Francois Legault, Quebec's premier, was talking about the regrets that he had that he wasn't on top of the cases in long-term care facilities. Tell us about that.
Yes, well, Francois Legault obviously Quebec has been hit very hard, and especially with the long-term care homes. Ontario, BC, Alberta have also had real big problems, but in Quebec, they've felt like they just needed some help. So they asked for the federal government to supply some Canadian Forces members. So 100 Canadian Forces members who are trained have been sent to work in the Quebec's long-term care homes for the time being. Considering the way things are going in Ontario, BC, and Alberta, which have had multiple, very large outbreaks, and these are the people that are the most vulnerable, we should probably expect to hear probably more demands and more requests as the week goes on. And so that's where they're at right now.
We're keeping an eye on Rideau Cottage, where the Prime Minister will be speaking. It's probably become one of the most famous doors in the country lately. Let's talk about masks on planes. That's going to be a new initiative that actually starts today.
Well, they've announced that anybody who is flying on the planes is going to be having to wear a mask. It's not going to be the N95s, but it is going to be some sort of mask to be able to stop the spread from not only from you getting it, but hopefully from you, if you possibly have it, if a traveler has it, from spreading it to other people. Now, there's a lot of controversy whether or not these masks work or not, or how well they work, but anything, the idea is that anything is better than nothing. So they're going to have it mandated that anybody who travels on a plane is going to be asked to wear a mask. If they don't have one, they can't get one, then they are going to be denied boarding. And that's going to cause problems in and of itself. I mean, we've seen various people in and around the world who don't agree with this. They're deniers, and they've been fighting back, and they've been arguing that they shouldn't have their civil liberties damaged because of COVID-19, and they should be able to do what they want. We've seen instances where people have been spitting on other people. People have been licking stuff in farm. It's not good. So It'll be interesting to see how this plays out, whether or not they're going to have increased security around the terminals and the airports. Because no doubt, while a lot of people, and most Canadians you would hope, would just go along with it and would agree that it will make everybody else feel better who are around them, there's definitely going to be people who are going to push back. So that's going to start soon, and we'll have to see how that plays out as well.
Mike, what are the concerns about the Canada Emergency Commercial Rent Assistance Program?
Well, that was announced on Thursday, and I think everybody can agree we can just call it SECRA. The acronym is probably a little bit easier to remember. It's meant to help the small businesses and commercial properties pay their rent for April, May, and June. We know that the small businesses have struggled immensely in this at staying closed or with the lack of business, and that a lot of them are saying that, you know what, bankruptcy might be the only option. So this secret, he hasn't announced all the details yet, and that's what these small business groups are really waiting to see. They're happy that something has been announced. Now they just want to see, you know, if the devil is in the details or not. So, I mean, the idea is to provide loans, but a lot of these small businesses say, you know what, loans, deferrals, they're not going to work for a lot of people, because if you have to pay, you know, if you get a $40,000 loan now and you have to pay it back in a year, and your business is cratered, how are you going to pay that back? It's just delaying the inevitable. So some people I've spoken with have said, you know what, they're thinking they're just going to have to do bankruptcy now, then why wait a year down the road and spread it out? We do know that there's like 97,000 restaurants and bars in this country. 2.4 million Canadians work in the hospitality industry. So there's a lot of people out there. It's a provincial thing with the rents. So it's kind of tricky. But, you know, a country like France has frozen rents. They froze rent and utilities. And so we want to ask Trudeau whether or not he's spoken with the provinces to see what can be arranged with that. I mean, it's a big deal. It's huge to do. But one thing the federal government has really pushed back on is doing more of a bailout. They would rather do loans, and they would rather be able to even do low-interest loans and even do some forgivable loans than have to bail out a lot of companies and small businesses. They have outright said that they do not want to do the massive bailout of the large companies, much like they did with the auto sector a decade ago. And a lot of the large companies don't want that either. They actually just want the low-income, low-interest loans. So a lot of these small businesses are really interested to see what exactly he means when he's going to be helping them pay with the rent and for the time being.
All right, Mike, we'll get back to you shortly. Yesterday, the Prime Minister announced a badly needed boost to the oil and gas industry, one that will help companies and workers. There have been repeated requests for aid because of COVID-19 and a huge dip in global oil prices. Now, the federal government is spending $1.7 billion to clean up abandoned oil wells in Alberta, Saskatchewan, and BC. Ottawa is also creating a $750 million fund to cut methane emissions. There's also help for businesses, $962 million to help those who don't have access to traditional financial institutions. The Liberals say the aid will save about 10,000 jobs across the country. Let's bring in Global BC's Legislative Bureau Chief Keith Baldry. Keith, why isn't this a bailout?
Well, I think it's more of a job creation vehicle, Robin. You've got those 10,000 jobs basically cleaning up these wells that have been abandoned by companies that have basically bailed out of the oil and gas sector. And I think it's something that's badly needed. It's interesting to see Alberta Premier Jason Kenney lauding this move by the federal government. But clearly, you're going to hear in the days ahead, this is not enough for that beleaguered sector. Alberta is reeling, probably hardest hit more than any other province when it comes to this economic downturn because it's coupled with the ongoing downturn in the oil sector around the world. So Alberta will be looking for more than just this, and whether you want to characterize it as a bailout or not, It is badly needed money for a sector that is reeling right now. Alberta likely has the highest unemployment rates in the entire country right now. Everybody's got high unemployment, of course, but Alberta is particularly hard hit here. So look for the Trudeau government. You and I talked about this last week, Robin. The governments now are in expansion mode when it comes to relief programs at every level. Things are not going to get more restricted or tighter in terms of whether you want to call it a bailout or just simply a relief package. Governments are under pressure at all levels to continue to provide relief to industrial sectors, whether it's oil and gas or others, or to renters, or to any other sector of the population as we reel through this this devastating economic crisis as well as a healthcare crisis. So I expect Mr. Trudeau to continue to appear in front of that cottage in Ottawa on a daily basis and announce more measures, more money out the door. Not sure how it's all going to be paid for at the end of the day. I don't think people are actually worried about that right now. They just want to see money out the door, people maintaining jobs, getting assistance with their rents or whatever. We're in a crisis mode and we're looking to government for help right now, not necessarily explanations of how they're going to pay for it.
Keith, the federal government says the worst is yet to come with the number of cases, but in BC, the cases are low. What do public health officials attribute that to?
They attribute it to basically the BC public buying into the measures introduced or advocated by BC's public health provincial health officer, Dr. Bonnie Henry. She hasn't really placed many orders on the table in terms of public health orders, other than closing restaurants and bars. She's just asking people to maintain their social distance, to keep 2 meters apart from each other, because that is the best way to combat the contagion here and the spread of the virus. And people seem to be buying into that on a daily basis. You see it over in Vancouver. I see it here in Victoria. People are keeping their social distance by and large. Not everybody. You still see groups of young people playing in the park, soccer games, basketball games, whatever. But in supermarkets and stores, you're seeing people keeping their distance, and that seems to be keeping the spread of the disease down. We're flattening the curve. We have not had a real increase in cases now for at least a couple of weeks. Our number of hospitalizations are down. The number of people in intensive care is down, and that's a consistent trend line. And that's why you've got public health officials now in BC for the first time talking about potentially easing some of these restrictions in mid-May, where we may see a resumption of elective surgeries. We've had more than 15,000 canceled or postponed over the last month, and that will the foot may come off the gas pedal in mid-May when it comes to elective surgeries. But we are going to be in this situation for months when it comes to social distancing and a restriction on movement and on ability to necessarily do certain things in the community. And that's going to be in place for months. But at least you can see a bit of a light at the end of the tunnel, but that bit of light right now is still pretty small.
Dr. Bonnie Henry talked about reopening society at a gradual level. Let's talk about schools. That was interesting when she talked about that.
Yeah, very interesting. I mean, this is a radical restructuring of the education system, and this may occur to right across Canada. She's talking about no longer will kids all go to school at the same time. They're going to have to be spread out through the day, staggered school hours. So we could be talking anywhere from 8 a.m. to 8 p.m. rather than your traditional 9 to 3 school day. You're going to have fewer kids in class right now. The days of 25 to 30 kids in a classroom are over for now, as social distancing rules will be applied in classrooms. That means 6, 8, 10 kids in a classroom. You start doing the math. There's only so many classrooms in a school, so those classrooms will be spread out. Use of them will be spread out over a period of time. I talked to Health Minister Adrian Dix, BC's Health Minister, yesterday. He says nothing's off the table here. We could be looking at, and again, other provinces may be looking at this as well, opening the schools up in the summer, because people aren't going to be traveling much right now. So your family vacation going away for July and August seems to be gone now. So why not use the schools to replace the lost school time that we've just seen the last 6 weeks, replace it by sitting in July and August. That's something that's being considered. It's not been, a done deal here, but I think you're going to see a creative use of the school system in a way we've never seen in our history before. Quickly, how are they going to decide what opens first? That's a great question, and Dr. Bonnie Henry gets asked that all the time. There's no real clear answer here. I think it's going to be a gradual reopening. But do restaurants and bars open with new rules that perhaps only have so many people allowed in the restaurant or the bar? at a time. It's going to be tough to enforce that. I think that's a question that's going to evolve over a long period of time, not a short period of time. I think the first thing we're going to see is a resumption of elective surgeries, which is really will assist those people on the waiting list. But reopening society is going to take some time. It's not going to be an overnight thing. It's going to take a lot of thinking, and there's probably going to have to be some restarts. And it's, you know, there may be a move to reopen something that doesn't work, and we're going to have to close it down again. But we're going to be in this for a long time. Dr. Henry and Adrian Dix yesterday in BC talked about 12 months to 18 months before we're really back to normal. And Dr. Henry points out, when we get back to normal, the normal's not going to look like it looked like back in December. That is gone. We're in a whole different world here when it comes to businesses, keeping our distance from each other, our school system, a whole different world that we've never really been through before.
Were you surprised, though, when she said mid-May they could be relaxing some of those measures?
Not really, because we've been asking her for some time. Because the number of hospital cases have not been piling up in BC's hospitals, at some point the public was going to ask, well, wait a minute, if we're not really filling up the hospitals with COVID-19 victims, why not open those hospitals to surgeries such as hip and knee replacements, all sorts of elective surgeries that people have been on the waiting list for a year to 18 months for, and they acknowledged we were going to get to that point. So they finally put a time frame on it yesterday for the first time. Not surprising, it's going to be mid-May. That's still 1 month away because they are worried about a potential surge in cases. But when you've got 4,500 beds closed in British Columbia, and have been closed for a month now, the question was, well, we've only got 120 people in hospital for COVID-19. I mean, it doesn't make sense. You've got a huge amount of beds open, relatively few of them being used for COVID-19, and the numbers weren't trending to use it.
Thanks so much. We're going to listen in on the Prime Minister's daily address.
Le Premier ministre Justin Trudeau qui s'approche du Lutrin.
Daily news conference. The United States have agreed to extend by another 30 days the border measures that are currently in place. This is an important decision, and one that will keep people on both sides of the border safe. It's another example of the excellent collaboration between our two countries, and I want to thank Minister Bill Blair for leading the discussions with the United States. Ce matin, je veux commencer en vous confirmant.
This morning, I would like to confirm that Canada and the U.S. have agreed to extend border measures in place for another 30 days. This is an important decision that will protect people on both sides of the border. I would like to thank Minister Blair for having led these discussions with the U.S.
We're all here today, but it is the weekend. And usually, a Saturday morning in April means getting outside to enjoy the sunshine, having a friend over for coffee, or just taking the kids to the park. But these aren't normal times. We're living through an unprecedented public health emergency, and we need to keep responding accordingly. So even as the weather gets nicer, and even in the weeks to come as we start seeing hopeful news, we can't let up. Because if we do, we could lose the progress that we've made. Later today, you may see some new ads with people you know, like Hayley Wickenheiser, Chris Hadfield, and Dr. Tam. And they'll remind you to stay home and save lives. That's how we keep each other safe. So stay at home. Limit your trips to the grocery store to less than once a week. If you do go out, keep 2 meters distance from each other. And as you do your part, know that we're here to support you.
Later today, you might see new ads that show people that you recognize, such as David Saint-Jacques and Dr. Mona Demer, our Chief Scientific Advisor. They will remind you that we can save lives by staying at home. As I oftentimes say, everyone has to do their part. Over the past few weeks, we've announced historic measures to help you to go through this crisis. With the CERB, the wage subsidy, and loans to small businesses, we are supporting millions of families and workers throughout the country. We still have a lot of work to do. We still have people that we need to help. So today, I am announcing new support measures. Our government will allocate over $306 million to help Indigenous businesses. This funding will be sent to Indigenous financial associations, and indigenous organizations. We will allow businesses to have an interest-free loan and non-refundable amounts of money so that they can weather the crisis and recover. The investments announced today will help millions of businesses to hold on up until the situation improves, including many businesses run by Indigenous women. They hire people throughout the country. People are employed in many different sectors, and this is one first step. Soon we will announce new measures to support Indigenous businesses as well as their employees.
I am very happy to announce that the government will allocate more than $306 million to give Indigenous businesses the support they need. This funding will be provided through Aboriginal financial institutions and administered by the National Aboriginal Capital Corporations Association. It will allow Indigenous businesses to access short-term interest-free loans and non-repayable contributions so they are better positioned to make it through and rebound after this crisis. Today's investment will help thousands of businesses bridge to better times, including many that are owned and run by Indigenous women. These businesses employ people right across the country, in small communities and big cities alike. They create good jobs in a whole range of sectors, so when we support them, we're supporting families and workers too. And this is just a first step. We'll have more to say soon on what else we'll do to help Indigenous businesses and the people who rely on them. Small business owners are at the heart of so many communities, and this is a tough time, whether you own a store, a restaurant, or are part of the hospitality sector. So we're going to be there for you. With this new investment and with measures like the Canada Emergency Business Account, the wage subsidy, and the Canada Emergency Response Benefit, we're focused on helping you. It will get easier, but until it does, we need to be prepared to persevere. And that includes ensuring that our frontline workers have the equipment and tools they need to do their jobs and stay safe. Yesterday, 2 planes full of N95 masks and coveralls arrived in Canada. More shipments will be coming in this weekend and into next week with additional medical supplies. I can also announce that we will begin receiving deliveries of face shields from Toronto Stamp very soon. They've shifted from their usual production of rubber stamps and ID badges and will be providing millions of face shields over the next 2 months. Canada continues
to receive shipments of PPE. Yesterday, 2 planes arrived with N95 masks and coveralls. Other planes with medical equipment will arrive next week. We are all impatiently waiting the moment where all of this will be over. We are all waiting for Saturdays where we can meet with our friends or bring our children to a birthday party. That day will come, but only if everyone continues doing their part. So during this weekend, stay home. Continue following the advice of our experts, and together we will persevere. Thank you.
Prime Minister, we'll now go to the phone lines for some questions. Just a reminder, it's 1 question, 1 follow-up. Operator?
Thank you. Merci. La première question, Michel Lamarche, TVA Nouvelle. À vous.
Oui, bonjour. Une petite question.
I have a question for you with regards to this agreement, with regards to the border closure. Mr. Trudeau, we seem to have a lack of equipment. Does this agreement allow for the same provisions for goods to be shipped? Yes, no, the same mechanisms are in place. So we allow for essential products and medical equipment and food to cross the border, our shared border, and we were going to continue to make sure of this.
is the same terms, just extended for another 30 days. It will ensure that we continue to get essential goods and services back and forth across this border.
Un suivi?
Bien sûr, par rapport
Now, with regards to these masks that should be produced by 3M, we know that this was quite complicated given the guidelines implemented by the American president, Donald Trump. Didn't you think it would be appropriate to have extra guarantees so that those who are providing masks, gowns are able to do it easily, that we're not having to count only on China? Yes, it's extremely important for us to continue to receive essential equipment from different places in the world, including the United States. We were very pleased to be able to ensure continuity of shipments from 3M. We're continuing to work very closely with the American government to make sure that we will receive all the required equipment.
Prochaine question, Mélanie Marquis, La Presse, à vous la parole.
Merci. Bonjour, Monsieur Trudeau.
Thank you. Marc Garneau said that travelers would have to use masks to take a plane. So when will this guideline enter into play? With regards to Minister Garneau's announcement, I have to highlight that right now we are banning all non-essential travel. We don't want people to start traveling, whether they have a mask or not. It's more important to stay home. That is what will allow us to protect against COVID-19. This is a measure that will continue and will help people in situations where social distancing is impossible, such as in a plane. Now, with regards to the measures that will be implemented, once we begin to ease up on the measures, we are under discussion. We are having lengthy discussions with scientists and experts to see what will be the best measures to ensure the protection of Canadians. And we will have more to say on this as discussions take place and as we get closer to this reality. Follow-up question. With regards to this agreement with the U.S., with regards to the border, there was an issue with regards to asylum seekers. Has anything been changed in the agreement? The agreement is the same. We have renewed the agreement for an extra 30 days. We're going to continue to make sure that our values and our principles as a country will be respected.
Thank you. Next question, operator.
Merci, thank you. Next question, Teresa Wright from the Canadian Press. Your line is open.
Good morning, Prime Minister. The Conservatives want 4 in-person sittings each week in the House of Commons with a reduced number of MPs, and they argue that the daily ministerial announcements happening in front of the media could be done in the House of Commons. What's wrong with that?
I think, first of all, it has been extremely important that every single day the Canadian public gets informed of measures that we're putting forward. We are putting forward new measures almost every single day, and I think it is essential that the media continues to have access to asking questions to better inform and ensure that Canada is functioning the way it needs to be. Part of that job in our democracy is ensuring that there is accountability through our parliamentary systems, and that is something that we are also very much focused on. We have proposed that the House of Commons return in some fashion every single week to permit engagement on accountability and also pass further measures to help Canadians. Right now, we're in a situation where MPs across the country and their staff are wondering if they're going to have to get on planes tomorrow and fly to Ottawa. Obviously, that is not something that, from a public health standpoint, we should want to see happening. But right now on the books, the rule is Parliament needs to reopen fully on Monday. That's obviously not a good idea, which is why we've proposed measures going forward that we're discussing with the other parties, and we certainly hope that we're able to come to an agreement so that we don't all have to convene in the House of Commons on Monday morning.
We're still having discussions with other political parties. We've suggested that the House could have sittings every week to ensure that the opposition can ask questions of the government, but also to adopt measures that will help Canadians. The reality is that on Monday morning, 333 MPs and their teams are supposed to be in Ottawa for the sitting of Parliament. Obviously, it would be a very bad idea given the current situation. So we've made proposals to try to make sure that we can do things differently so that we can keep our democracy healthy while ensuring that people are safe. We truly hope that the other parties will agree with some of the measures that we're suggesting. I think that it would be a real problem if we had to go back to the House of Commons on Monday morning.
Yes, many people on social assistance programs are surviving on less than people who are getting the CERB. And many marginalized Canadians will simply never be able to access the CERB as it is structured. Rather than continue to tweak it, why not just make the CERB universal?
We moved very quickly on replacing income for people who lost a paycheck because of COVID-19. These are families who were relying on that next paycheck to be able to pay for their rent, to be able to pay for groceries, to be able to support their children and their parents. This was the absolute priority that we needed to move forward quickly on, and with the moves we were able to make, over 7.5 million payments have been made already, and there are obviously many more to come. At the same time, we recognize the particular vulnerability of marginalized communities, of particular groups, and that's why we have put forward significant measures to try and help them, whether it's through shelters, through support for charities and charitable organizations, or extending measures so people who work a very small amount of hours a month can still receive the CERB. These are the kinds of things that we're looking at, and we're continuing to move forward on getting the help out to people that we need to.
Thank you, and we'll take one more question on the phone. Operator.
Merci, thank you. Next question, Christopher Gooley, Tatayi, your line is open.
Good morning, Prime Minister. You've been holding regular conference calls with the premiers during the COVID crisis, but why have you not reached out to the opposition leaders in a similar way, particularly when you're governing in a minority parliament and one that has not been convening regularly?
We have been in very close and ongoing conversations with opposition leaders, both me directly and mostly through ministers and officials, and regular briefings that happen from Health Canada and officials to keep people apprised on these issues. But you're absolutely right that we do need to keep our institutions and our parliamentary principles strong, which is why we've proposed that Parliament could come back in a modified way every single week to ensure accountability, to ensure that we can move forward on legislation, and that's what we're very much hoping we're going to get agreement on from all parties, because the alternative would be returning to Ottawa on Monday morning with a full House of Commons and all the staff associated with, and I think we can all recognize that that would be a mistake at this point.
And a follow-up, Chris?
Yeah, some of the changes your government has made, though, to the Canada Emergency Response Benefit for workers, the wage subsidy initiative for businesses, and the recent revisions regarding emergency loans and commercial rent assistance for small businesses were proposed by the opposition parties. So do you now think that looping in the leaders could save valuable time and get programs and money out the door sooner?
we have been looping in leaders and opposition members from the very beginning. Indeed, the proposals on expanding, on filling gaps have come from MPs of all parties, including many, many Liberal MPs who've been passing the message through. We know that Canadians are working together in unprecedented ways to fill gaps and to respond to these challenges. And it is wonderful, quite frankly, to see so many suggestions coming forward, many of them that make it into tweaks and improvements and changes to programs that are designed to help as many Canadians as possible. It is a great sign of collaboration and solidarity of Canadians working together on leaning on each other, on being there for each other, just like we're seeing outside of the political world as well.
Hi, Prime Minister. Crystal Logue with Global News. Today you said small business owners are at the heart of so many communities, but small businesses are terrified about the possibility of getting out of this and having enormous debt piled onto them in the form of rent deferrals and loans. The fear is that if they're either going to run out of money now or a year down the road, these businesses have legally been forced to close and yet still legally have to pay rent and utilities. Have you considered financial aid that would not have to be repaid or discuss rent forgiveness or control with the provinces?
We have discussed the issue of commercial rent with the provinces. I had a good conversation with them on Thursday evening where this came up. We are looking at it very, very closely. We have a number of proposals that are working their way through the system, talking to various industry groups and renters associations, as well as looking at the provinces. The provinces have jurisdiction over rents and the relationship between landlords and tenants, so we need to work with them, which is what we are doing. We recognize there are very different realities and systems right across the country, but we also have heard very, very clearly from small business owners that the wage subsidy is helpful, but fixed costs are a real concern, and that is something that we're going to have more to say on soon.
Ian Wood, CTV News. Prime Minister, BC's seen some success flattening the curve and has indicated they might look at loosening restrictions. You've said it's too soon to be doing this, and meanwhile, provinces like Ontario and Quebec are still in the thick of it. Are you concerned a difference in messaging and measures will enable people to disregard what's in place now? And are you going to allow provinces to make the decision on reopening, or will the federal government need to give a green light?
I think Canadians understand that what we are doing now has been tough, but is essential on getting through this in the best possible way. And Canadians are also really worried that if we reopen too quickly or too soon or in the wrong way, we could find ourselves back in this situation a couple of months from now, and everything we will have sacrificed during these months will have been for naught. So we are being very, very careful in how we move forward as a country. I have spoken extensively with the premiers about this issue, and everyone recognizes how cautious and careful and vigilant we need to be. There is a real desire to ensure that we are coordinating our messages, our guidelines, the principles that will underline how we move forward. But of course, the situation is very different right across the country from one region to the next. And the measures that they will be able to move forward with at various moments will vary as well. That's going to be an important part of the recovery here. We need to make sure that we're working together, as we have been, in an unprecedented way between premiers and the federal government and municipalities and various other communities to make sure that we're doing the right kinds of things and that we're sending the right messages to Canadians every step of the way. But the message remains that we have to be extremely careful to do this the right way in a coordinated and collaborative way.
The Canadian meat industry is saying it is facing a crisis as processing plants have to close or slow production because of COVID-19. And the Canadian Federation of Agriculture has said that your government needs to prioritize food production so we don't have shortages. We've heard the government is considering all options, but what are they so that Canadians can feel confident that they'll be able to buy meat and food in the coming months?
I think ensuring the continued flow of groceries and our food supply chains is absolutely a priority. But so is arresting the spread of COVID-19. So is ensuring that workers in all industries across this country can remain safe. getting that balance right requires us all to step up very carefully, because we need to make sure that, yes, we are continuing the flow of great Canadian food to people, and indeed, we need to ensure that we have as much domestic food security and stability as we possibly can. And that means taking advantage of the summer months that are coming up and the growing season and the planting season now. At the same time, we have to make sure we are doing things that are keeping farmers, agricultural workers, producers and transformers safe. And that is what we're very, very much attentive to now.
Good morning, Prime Minister. Ashley Burke, CBC News. Harvard researchers have suggested that there needs to be at least 500,000 tests being done a day in the U.S. in order to safely reopen the economy. What is the specific number of tests that Canada needs to hit daily to safely ease up restrictions here? I think
every day we are working on new technologies, on better coordination, on accelerating the pace of testing. It has been somewhat uneven across the country. There are places that have done very, very well. There are some places that have faced challenges that they are busy overcoming. But we are confident we are going to be able to significantly ramp up testing. And all the premiers recognize that extensive testing is an essential part of any plan to loosen the controls on people and start reopening or restarting the economy. This is something that the federal government is very much engaged in with the provinces, ensuring there are enough tests, there are enough swabs, there are enough reagents. These are the kinds of things that we are all working on together. We know we have to do much more than we're doing now, and we are tracking towards doing that.
Many of the cases in Canada have come from those returning from the U.S. Trump's talked continuously about reopening the U.S. You said today the border agreement's going to stay in place. But if the U.S. does loosen some restrictions in the next few weeks, what kind of health threat does that pose to Canadians?
We have the border restrictions in place where non-essential travel across the border will not be permitted. We will continue to take the measures necessary to keep Canadians safe while ensuring the continued flow of our essential supply chains on which so many Canadians depend. Okay. Nous allons continuer d'être très vigilants.
We will continue to be very vigilant with regards to our borders and our international travelers. We will continue to work jointly with the Americans to ensure our safety. We have extended the measures at the border. At each and every step, we will do what's required to protect Canadians and to ensure continuity of our supply chains.
Prime Minister, I'm wondering if you can tell us what the impact on Canada's stockpiles has been for PPE when the government closed so many of its warehouses across the country.
Over the past weeks, we've been focused on delivering PPE to the provinces, on delivering the necessary equipment to ensure that our frontline workers who are putting their lives forward to keep Canadians safe are properly protected. The efforts continue. I mentioned 2 plane loans coming in over this weekend, more coming in over the coming days. We are confident that we are in a good place around PPE and will only get better as more and more Canadian producers and suppliers come online. It has been something extraordinary to see the level to which Canadian manufacturers have been stepping up to get involved, and we are in a much better place than we were a number of weeks ago. Of course, there is a need for continued vigilance, and there will, of course, be many lessons learned on how Canada can be better prepared for any future outbreaks than we were this time.
Bonjour, Monsieur Trudeau. Philippe Vincent Foisy de Radio-Canada. Une question peut-être un peu simple.
I have a simple question. I would like to know, why are we extending the closure of the border with the U.S.? Is this because you have fears that the U.S. president will open up the economy too early? Is it because they're unable to manage this pandemic? Why? We have closed our borders to international travelers for many weeks now, and this was for people from all countries of the world. We took a few extra days to do this with the U.S. because we needed to make sure that the border closure would be a coordinated approach and that we be able to keep our supply chain flowing and that we would be able to act together with our neighbor and partner. These measures were essential to protect Canadians and to limit the spread of the virus. And we will continue with these measures for many weeks to come.
We made the decision a number of weeks ago to close our borders to international travelers. We recognized that this was a significant measure, but was an important one in order to prevent further spread of COVID-19 from coming in from overseas. It has contributed to why we are now in many parts of the country talking about seeing a flattening of the curve, which is good news. We included the United States in those measures because these are measures that we put in place around the world. We did take a couple more days to ensure that we were properly coordinated with our closest neighbor and most important trading partner, and that was very, very effective in it being a mutually agreed on and carefully coordinated measure. We will continue those measures both with the United States and with the world for what is undoubtedly going to be many more weeks.
Sur les négociations avec l'opposition pour le Parlement.
With regards to negotiating with the opposition parties for the opening up of the House of Commons, you are able to reach an agreement with the U.S. Why can't you reach an agreement with the opposition parties in Canada? We have a situation where there are many parties who agree. They agree that we should proceed with measures to have a limited sitting of the House of Commons each week. But there's one party that wants to have a parliament sitting 4 or 5 days a week, and I don't think that's the correct thing to do. I don't think it's balanced, and we're continuing with our discussions.
Many parties, opposition parties, are in agreement that limited sittings every week are a good measure to both ensure accountability and continue the work that we're needing to do to pass legislation for Canadians. We are, of course, looking forward to being able to see more virtual parliamentary sittings that will allow MPs from all around the country, not just from the National Capital Region, being able to participate. There is one party that still wants more than I think is wise at this particular time in terms of a public safety approach and in terms of ensuring that we are getting that balance right in moving forward for protecting our institutions. But we are hopeful that we're going to get to a good place soon. Merci tout le monde.
Into the Prime Minister giving his daily address. Let's bring back Mike Drolet and Keith Baldry. Keith, no surprise that the border measures have been extended another 30 days, but the reality is it's going to be a lot longer.
Oh, most certainly, Robin. I think this is going to be, you heard the Prime Minister at the end there say the border will remain closed for many more weeks. And I think you can put that in terms of months. So I think we're a long way from opening up the border. Again, even though Donald Trump wants to open up the U.S. economy, the border remains an important barrier between the two countries. And I just don't see that situation ending or changing significantly anytime soon.
Mike, let's talk about the masks on the planes. Marc Garneau made that announcement yesterday. What did the Prime Minister have to say about it today?
Well, he spoke about how there were 2 plane loads coming in this weekend and more in the coming weeks. He said he's confident that we're going to have enough PPE for frontline workers across the country. You know, that's an important statement to make, considering that we've heard from a lot of PPE workers, a lot of provinces who say that they have been, they're running low, and that they're asking that frontline workers reuse masks and really take a smart approach to how they go through their inventory right now. So, you know, if what Justin Trudeau says is true, then we should be expecting far more coming in the weeks ahead.
Expand on the masks on planes, passengers having to wear them to maintain social distancing, although he did reinforce that non-essential travel is still banned.
Yes, well, I mean, that's still going to come into effect where they're going to have mandate that everybody who flies on a plane right now to and from Canada must wear a mask. That is for not only the individual safety, but for everyone around them. And for people who refuse to wear masks, they're going to be asked to not board the plane. They're going to be denied entry. And this is going to be enforced, I believe it's starting today or tomorrow. But it's this is one of the measures they have in place to try to control the spread of COVID-19.
Keith, the Prime Minister was asked about the flattening of the curve in BC. The numbers are down, and suggestions from Bonnie Henry that we're going to relax some of these measures mid-May. But he was asked if that was mixed messaging, because doesn't he ultimately have say, or is this in the province's hands ultimately?
Well, a number of measures are in the province's hands. For instance, the opening of restaurants and bars are at the public health officer's discretion. Under most provincial public health acts, the provincial health officers have significant power. Now, of course, the federal government has power as well, but what we're seeing in terms of restrictions and lockdowns, other than airports and airline travel, which is a federal jurisdiction, the provinces usually have more jurisdictional authority over a number of actions or things that they can impose on the community. Back to masks, Robin, I find that the changing protocols on masks are fascinating. At the beginning of the pandemic, people were actually advised not to wear masks because they were thought to perhaps give you a false sense of security and not lead you astray from getting away from social distancing. Then it was like, okay, I guess masks are not a bad idea. If you need to wear one, it won't hurt. Now it's mandatory. You have to wear a mask to get on an airplane in this country, which is a sign, I think, or another indication that we're learning as we go along through this pandemic. And public health officers are learning as well. And Dr. Bonnie Henry, one of the first things she said in BC at the beginning of this was that what I'm saying right now may change as we go through this. We're going to learn things, we're going to adapt things, we're going to accustom ourselves to different ways of behavior and advice. And we're seeing that on a number of fronts, whether it's wearing masks or whether it's social distancing or whether it's closing restaurants. What was the sort of the activities or the rules at the beginning of the pandemic are substantially different in many cases of what they are now, and they will continue to change as we go through this, and they will become looser, and in some cases may become more restrictive. But right now, I think, again, BC at least is seeing a bit of light at the end of the tunnel, but we're a long way from getting through this, as is the rest of the country.
It's launched a whole cottage industry. People are making their own masks now, and you see it on Instagram, you see it on Twitter and all of that.
My wife's made 24 of them so far, and she intends to make more this weekend. They're a hot seller. Not a seller, you actually give them away or sell them for charity. It's a big cottage industry.
Absolutely. Mike, every day the Prime Minister makes some sort of announcement, and today it was about new support measures for Indigenous communities. Tell us about that.
Yes, well, he announced $306 million going out to Indigenous communities in the forum, and this was actually really important the way that he said that. Interest-free loans, not just low-interest loans. These are interest-free loans and also non-repayable contributions, and they're going to be giving these out through Aboriginal support systems. So it's not going to be going through just the traditional banks and stuff. It's going to be It's going to be going into the Aboriginal community immediately, and it's going to be going to help a lot of Aboriginal businesses run by Aboriginal women. So once again, it's $306 million that's going to go to for business support in the Aboriginal community, and it's going to be in the form of interest-free loans and non-repayable contributions.
Keith, the Prime Minister was pressed on whether the House of Commons should go back to a regular business, but he's saying it would be a mistake at this point.
Yeah, I think the public's actually with him on that point. I don't think there's a lot of people clamoring to have more than 300 MPs or even a smaller number get on an airplane and fly to Ottawa right now. It is an interesting debate, though. I mean, we don't want to shut our traditional democratic institutions down. You do have to ask questions of the government in our democratic settings, but I don't think there's a clamoring for people to en masse gather in Ottawa right now in the same building, when the message to everyone right now is to stay home as much as you can, to minimize minimize your going out in public as much as you can. Minimize your contact with people from outside your household as much as you can. And for MPs to suddenly gather and have debates in the House of Commons, I think it's a bit of a counter message there. And it's a challenge. I mean, we don't want to abandon our democratic institutions, and certainly the tough questions have to be asked of the government as they spend literally more than $100 billion here with no accountability right now. But I think Mr. Trudeau's probably closer to public opinion right now than Andrew Scheer is. There's a bit of tone deafness sometimes from the opposition parties as they struggle to remain relevant, as everybody is much more in a crisis mode and they want governments to help and to send checks out as quickly as they can and not worry about the political debates that usually account for most of our political culture in normal times. But these are not normal times. So I think the House of Commons not sitting fits more where the public's at right now than where Mr. Scheer's at.
These aren't normal times on so many fronts. Mike, commercial rent is a major issue for businesses. We talked about that earlier. Let's recap that.
Well, commercial rent is something that has been on the front of mind, obviously, for a lot of small businesses that have been forced to close, and yet they also have to pay their rent and they have to pay their utilities. So they have no way of lawfully making an income, yet they have to lawfully put money out. Well, on Thursday, the Prime Minister announced, a fund called a SICRA that would help pay for rent for 3 months. Except he didn't really give too many details at the time. Well, we asked him today about it, and he put the question off. He didn't really answer because today he was talking about Indigenous businesses getting interest-free loans. He still hasn't said exactly how he's going to help the businesses. The rest of the businesses in Canada, whether or not it's going to be, because a lot of them had deferrals with their landlords. They don't really like that because that's just putting the problem down the road. And then with low interest loans, which again puts the problem down the road. So he has said that he is working with the provinces because a lot of this is provincial jurisdiction with landlords and tenants. So and every province is different. So it's a complicated mess, understandably so. But it's something that has to be addressed and has to be addressed quickly because the next rent cycle is coming up really soon, and a lot of these businesses who haven't made a penny in the last month and a half are going to have to either come up with rent or figure something out.
For both of you, testing, that's a question that keeps coming up at every one of these news conferences, whether it's on a provincial or a federal level. He seems to avoid that question, though, doesn't he?
Well, and I don't necessarily blame him.
He certainly does.
Go ahead, Mike. Sorry.
Go ahead, Keith.
Keith, why don't you start?
I defer to you, sir.
Okay. Testing comes up more than any other issue when we're on the line with Dr. Bonnie Henry here in British Columbia. I think it's the case across the country, where everybody becomes an expert on testing and thinks that mass testing is the way to go. Dr. Bonnie Henry out here, and I think Theresa Tam and other provincial and federal and provincial health officers have different strategies when it comes to testing. It doesn't mean mass testing of 100% of the population. It means strategic testing for various reasons. It started in BC to test travelers because those are the people who had the virus more than anybody else coming in from other countries. Then it shifted to frontline health workers because they were in contact with the virus more than anyone else and the people around them, and they were the people most likely to have the virus. Now it's gone to a more community-based, broad-based, to try to find clusters. It doesn't really matter if someone has the virus with mild symptoms, as most people will be in that condition. 80% of the people who have mild symptoms. It doesn't really matter if you spend all this expenditure in time and resources to test that person. What the key is to find the most serious cases, and those are the hospitalizations, and that's why the testing is sort of targeted at a community level in terms of finding those clusters of people potentially most vulnerable. So it doesn't matter if you've got 100,000 tests versus 60,000 tests. It doesn't necessarily put you in a better situation. And that's the philosophy articulated out here by Dr. Bonnie Henry, and you're going to see that from other health officers across the country as well. Mass testing is not the magical answer here.
But Mike, in Ontario, Doug Ford ordered more testing.
Well, he is mandating that he wants 16,000 tests done a day, and on Thursday they only did about 9,000. He wants to see far more tests. He's actually not suggesting that everybody be tested. He is also going for the whole strategic testing approach, but he has prioritized everybody working with in long-term healthcare homes, in healthcare workers, family members who live with healthcare workers, that sort of thing. So, I mean, compared to the U.S., where, I mean, Donald Trump says he needs, 500,000 tests a day to be able to know how this disease is progressing. But here in Canada, in Ontario, they want to be able to do strategic testing. It's a far different approach.
All right, gentlemen, thank you so much for your time today. Let's recap what we heard from Prime Minister Justin Trudeau today. There's an agreement between Canada and the U.S. to extend the border restrictions for another 30 days. Today, Trudeau announced $306 million in financial support for Indigenous businesses, and the Prime Minister gave an update of the delivery of personal protection equipment. Yesterday, 2 planes arrived with N95 masks and coveralls, and Trudeau says more is on the way, ensuring our frontline personnel will have what they need to respond to the COVID-19 pandemic. And you can find full details on globalnews.ca and tonight on Global National. I'm Robin Gill. Thank you for watching. We now return you to regularly scheduled programming.
This has been a special report from Global News.
Bonjour tout le monde.
Hello, everyone.
Hello, everyone. I would like first to start on behalf of Dr. Tam, who is Canada's Chief Public Health Officer, to share the usual update on the number of COVID-19 cases in Canada. There are now 31,884 cases, including 1,309 deaths. For lab testing, we have completed tests for over 507,000 people, with 6% confirmed cases. Bonjour tout le monde. Au nom de la Dr. Tam, qui est administratrice en chef de la santé publique du Canada, j'aimerais fournir une mise à jour rapide sur la situation de la COVID-19. Nous avons aujourd'hui un total de 31 884 cas, 1,309 décès, 507 000 tests ont été effectués et environ 6% de ces tests se sont avérés positifs. Earlier this week, Dr. Tam said that there is some cause for cautious optimism coming from the data. This still holds true, but we must remain vigilant, stay focused, and keep our eyes on the ultimate goal, which is limiting the spread of this terrible virus to protect our families, our friends, and our fellow Canadians. Dans certaines régions du pays, l'épidémie perdra de son ampleur
Some parts of the
plus tôt que
country
dans
will
d'autres
experience
régions.
the epidemic slowing
Mais
down
où que nous
earlier
vivions
than
au
other
pays,
parts of the country.
chacun doit
But no matter
continuer
where
de
you live in the
contribuer
country,
à ralentir
everyone
et
must
à
remember to
arrêter
keep
la
doing the things that
transmission
are
de la
helping to
maladie
stop the
dans nos
transmission
communautés.
of COVID-19 in our
Il s'agit
communities.
notamment de se laver
This
souvent les mains,
includes washing
de
your hands
s'éloigner
frequently,
physiquement les uns des
practicing
autres
physical
et de rester chez
distancing,
soi
and
autant que
staying
possible.
home as much as
Si nous
possible.
ne conservons
Unless
pas
we
ces
all
bonnes
remain
et
diligent in
importantes
maintaining
habitudes,
these very
de
good
nouvelles
new habits,
éclosions
new
peuvent
outbreaks
survenir
can be
n'importe
sparked
où et
anywhere
n'importe quand.
at any time.
Some parts of our country will experience the epidemic slowing down earlier than others, but no matter where we live in our country, everyone must remember to keep doing the things that are helping to slow down and then to stop the transmission in our communities. This includes washing our hands frequently, physical distancing from one another, and staying home as much as possible. Unless we all remain diligent in maintaining our new habits, new outbreaks can be sparked anywhere at any time. Remember, as Dr. Tam also said, this is not a sprint, this is a marathon. We need to keep doing the right things and keep being strong all together. Ensemble, nous traverserons cette crise en gardant espoir et en continuant de prendre soin les uns les autres. Et en terminant, j'aimerais aussi donner rapidement une mise à jour sur la prestation canadienne d'urgence qui, comme nous le savons, fournit une aide absolument essentielle à des millions de Canadiens et de familles qui se trouvent dans des situations financières et économiques très difficiles. En date du 16 avril, 6,4 millions de demandeurs ont fait une demande pour un total de 7,9 millions de demandes et 7,6 millions de ces demandes ont déjà été traitées.
Many of which have already been processed.
Provide a very quick update on the important Canada Emergency Response Benefit, which is helping millions of Canadians, workers and families go through the very difficult economic times of the crisis. We, as of April 16th, we have received a total of 7.9 million applications from 6.4 million different applicants. Six of these 7.9 million applications, 7.6 million have already been treated. Aujourd'hui, j'ai la chance d'être en compagnie du ministre Mark Miller, qui est ministre pour les services aux Autochtones. J'ai aussi la chance d'être en compagnie du Dr. Wong.
Also with us today,
Dr. of being in the company of Minister Mark Miller, who is Minister of Indigenous Services, and of Dr. Wong. So I would first turn to Minister Miller, to Mark, and then to Dr. Wong. Mark?
Merci, Jean-Yves.
Thank you, Jean-Yves.
Danse Ulukut. Good afternoon. Sego. Bonjour. I want to start by saying that over the last few weeks, Indigenous communities have taken many positive measures to protect their populations in the face of COVID-19. I want to recognize their important work and the strength that they've shown. To the First Nation, Inuit, and Métis leaders, elders, and youth, your continued leadership most vulnerable, as we are all focused on the public health response that will save lives. In addition to the previously announced $305 million in funding to address immediate needs and to help Indigenous communities prepare and react to the spread of this virus, this morning the Prime Minister announced $306.8 million for Indigenous businesses as we recognize their unique needs. These businesses are the backbones of communities across this country, and they are integral to the vibrancy of the Indigenous economy and the Canadian economy. While larger Indigenous businesses may already be clients of mainstream banks, we recognize that smaller Indigenous businesses may be disproportionately affected by this unprecedented and unique situation. These businesses may and are already facing unique challenges such as being in rural or remote locations and having less access to capital. The emergency funds announced today will be provided to Indigenous businesses through the 59 Aboriginal financial institutions, enabling them to keep supporting the thousands of small and medium First Nations, Inuit, and Métis businesses, a great number of them run by women. It will help stabilize Aboriginal financial institutions and will allow for short-term interest-free loans and non-repayable contributions, offering maximum flexibility in supporting local businesses and ensuring they are well positioned for the recovery to come. Nous reconnaissons également les défis uniques auxquels sont confrontées de nombreuses communautés dans les territoires, notamment l'accès au transport aérien pour la nourriture et les provisions essentielles. Nous avons annoncé en début de semaine un appui financier de près de 73 millions de dollars pour soutenir
we announced financial support of $73 million to support Yukon, the Northwest Territories, and Nunavut so that they can slow the spread of the virus based on their needs and priorities. We will continue to work with our Indigenous partners everywhere in Canada to identify their needs.
In close coordination with communities to ensure necessary resources and supplies such as PPE, bottled water, hand sanitizer, and testing are in place to prevent and combat the spread of COVID-19. In collaboration with Indigenous communities, we will continue to adapt plans and provide surge capacity as the situation evolves. To date, we've shipped 555 orders for PPE, personal protective equipment. In regards to testing, nursing stations and health centers in each region have the supplies required to administer tests, and we are continuously working to ensure a consistent supply as needs arise. Et bien que nous ne connaissions pas actuellement le nombre de tests administrés en dehors des réserves en ce qui a trait aux Autochtones, puisque les gens n'ont pas à s'identifier comme autochtones dans le cadre du protocole de test. Je soutiens les appels en faveur de meilleures données, y compris des informations indiquant si les patients testés sont des membres des Premières Nations, des Inuits et des Métis.
Collecting better data. It would be helpful to collect information about patients and whether they are Indigenous.
I'd like to highlight some of the great work being done in communities, for example, in Akwesasne, which is about to open its mobile testing unit and will be deployed across its territory to increase testing and awareness in the days to come. As of April 17th, there have been 52 confirmed COVID-19 cases in First Nation communities on reserve and 12 confirmed cases in Nunavik Inuit communities, as well as one death. I'd like to extend my sincere condolences to Six Nations of the Grand River. Our thoughts are with the families, loved ones, and community as they heal during this difficult time. While we are thankful for the low number of cases in Indigenous communities to date, we are not taking and should not take this for granted. This is a function of a number of things, notably remoteness of the communities, some of the aggressive measures taken by the leadership, medical and political, in communities, learning from the experience, and being in a position to take act of what's gone on across the globe, learning from the good and the bad. Nous savons également qu'avec l'arrivée du printemps vient la saison des crues et des inondations. Nous travaillons présentement avec les communautés autochtones pour nous assurer qu'elles sont bien préparées aux situations d'urgence, y compris aux inondations potentielles. Par exemple, Services aux Autochtones Canada fournit $2,1 millions à la Première Nation de Kashechewan pour soutenir son plan visant à réduire les risques présentés par le virus et les inondations potentielles dans sa communauté. Ce financement soutient la décision qu'ils ont prise de s'isoler du COVID-19 dans des camps de chasse traditionnels
made to isolate away from COVID-19 in traditional hunting grounds this spring to hunt goose and practice other traditional practices. This is part of broader public health recommendations to strengthen physical distancing during the pandemic. And the situation and circumstances are very unfortunate. That said, we're very happy to support this initiative because when Indigenous peoples return to the land, that is a very positive and healthy type of physical distancing for them, and physical distancing is so important to prevent the spread of the virus. This new funding will help purchase supplies, equipment, such as tents.
We are supporting these communities throughout this difficult time, and our crisis management team is constantly in touch with the First Nation of Kashechewan to plan emergency preparedness plans.
We continue to recommend that First Nations with upcoming elections not proceed with elections at this time due to the current public health risks associated with large gatherings. Accordingly, last week we introduced a temporary regulatory option, the First Nations elections cancellation and postponement regulations that enable First Nations leaders to continue in their positions for up to 6 or 12 months so that they can stay focused on keeping their communities safe in the face of COVID-19. We've been in direct communication about this option with communities who are currently or will soon be undergoing the election process, and I encourage communities to avail themselves of this option. But I want to be clear, the final decision to hold or postpone elections ultimately lies with community leadership, and we must respect that. Should communities decide to proceed with elections as scheduled, we stand ready to provide advice on measures to minimize the risk of spreading the virus to community members. All this being said, we recognize that more support will be needed. By working together, we can save lives, and we will be there to make sure no Indigenous community is left behind. Miigwech, Nakumik, merci. Thank you.
Merci beaucoup, Marc. Dr. Wong.
Thank you very much, Mark.
Bonjour.
Dr. Wong.
Je voudrais
Hello.
commencer en soulignant
I would like to begin
les points importants pour la
by
santé publique.
highlighting important public
First
health
of all, I want to actually
messages.
start by highlighting some very important principles about public health. It is very important to take physical distancing seriously. Avoid crowds, gatherings, avoid non-essential travel, limit contact with people who are at high risks of complications, such as the elderly, people with underlying medical conditions. Isolate if sick, and go home if you're sick. It is important to practice hand and respiratory hygiene. We need to stop smoking, stop vaping. Et pour notre tension, il est important de contrôler notre tension et notre diabète et aussi
to
notre
properly
poids.
manage
It is
our
important
blood pressure, diabetes,
to make
and weight.
sure that we control our cardiovascular and pulmonary diseases as well. So with that, I'm going to say Nakumik, Miigwech, merci et thank you.
Merci, Dr. Wong. Nous pouvons maintenant passer
Thank
aux
you,
questions.
Dr. Wong. And we are now ready to take questions. Thank you, Minister. We will begin by questions over the phone. One question and one follow-up per reporter, and then we'll take questions in the room.
Thank you. Merci.
Over to you,
Our
operator.
Notre première question nous vient de
First
Philippe
question,
Vincent Foisy avec
Philippe
Radio-Canada.
Vincent Foisy, Radio-Canada.
Oui, bonjour. La première question pour M. Duclos.
Hello. I have a question for Minister Duclos.
Monsieur Duclos, est-ce que là,
Minister
on parle de la
Duclos,
frontière américaine là, qui va être fermée pour un mois de plus?
we
Est-ce
have
qu'on est quand même
extended
sûr,
the
est-ce que vous avez des
border
assurances
measures
qu'on va être
with the
capable
United States?
d'avoir du matériel médical de
Have
protection
we
qui va
obtained
provenir
any
des États-Unis?
guarantees that
Que
we
ce
will be
matériel-là
able
va
to
venir
receive
et qu'il y aura pas de
essential
problème
medical
à la
supplies
frontière
from the
ou
United
qu'il y
States
aura pas de problème
without
avec
any
l'administration
hiccups at the
Trump?
border or without
Bon,
any
comme
issues
vous
with the
le
Trump
soulignez,
administration?
Philippe
Answer,
Vincent,
Minister Duclos.
la relation avec
Thank you for the
nos
question,
voisins
Philippe
américains est
Vincent.
absolument essentielle dans le
As
contexte actuel.
you
Elle est
have
importante dans tous les
mentioned,
contextes, mais en
our
situation
relationship
d'urgence
with the
comme
United States is
nous le
very
vivons,
important
c'est
in this
une
context
relation
and in all
que
contexts.
nous surveillons à tous les jours. Nous
In the
parlons
current
à nos
situation,
partenaires à
our
tous les jours.
US-Canada
Comme vous l'avez
relations are
indiqué,
very important.
l'entente
We
que nous avions
have
il y a
conversations
déjà
with our
quelques
partners
semaines
every
est
single
renouvelée
day.
pour un autre 30
The
jours.
border
Il y a
agreement
dans
that we
cette
reached
entente,
a few weeks
évidemment,
ago has been extended for another 30 days.
l'assurance que le passage des biens et services essentiels dont on a besoin au point de vue
And
alimentaire,
we
au point
need
de
to
vue
ensure
médical,
the
et aussi à
continued
d'autres
flow
points
of
de vue.
essential supplies,
Cette assurance, elle est
food,
présente,
medicines.
donc nous sommes
You've
heureux
asked
que
whether
nous ayons
we
pu
received a
rapidement
guarantee to that effect.
renégocier cette
Yes,
entente pour un autre 30
that has
jours,
been
mais
guaranteed.
on a aussi
And so we are
évidemment
confident
d'autres
in
discussions
extending this
importantes
deal for another 30
pour
days.
la
And
continuation de
of
la
course,
relation
we have discussions
d'approvisionnement
about
dans
other
les deux sens
topics
de la
with
frontière
a view
qui
to
est,
ensuring flow of
qui va
goods
bien,
and supplies
comme dans toutes les
across the
relations et
border
certainement
in
dans la
both
relation avec
directions.
notre voisin du Sud qui
Our
va continuer à
Canada-US
demander
relations are very
beaucoup
important and are
d'attention
very
et de travail.
positive, and we work very hard to maintain a good, strong relationship.
OK, ben allez-y en anglais.
So I was saying in French what most Canadians already understand, which is that the relationship with our friend and neighbor is not only important in all contexts, but absolutely essential in the current emergency context. We are pleased with the fact that we were able to renegotiate the agreement that we had achieved just a few weeks ago for the next 30 days, which achieves a number of different objectives, but one of them is the absolute necessity to keep the movement of essential goods and services across the frontier in both ways, in both directions, because goods go south, goods go north, and those goods, medical, food, and other goods, are absolutely important to maintain the security and the health of Canadians.
Follow-up question, Philippe Vincent Foisy, Radio-Canada. Question. I have a very specific question about personal protective equipment at the border. Have you received a guarantee from the American government that 3M and other American companies will be able to export medical supplies and protective equipment to Canada? Will we be able to import these supplies from American companies? Have you received a guarantee to that effect from the American government? Will we be able to continue receiving medical supplies and especially personal protective equipment? Answer, Minister Duclos. The watchword is vigilance. These past few weeks, we have observed that essential goods, including medicine, have been able to flow across the border very well. But the motto is vigilance. Yes, we have a very good relationship with the American government, but this relationship will continue to be put to the test over the next few weeks. We will remain vigilant to ensure that our Canada-U.S. relationship, which is currently very strong, we will ensure that it continues to remain strong in the next few weeks.
Of the essential discussion and action that we have around the transit of medical goods, I think we first must admit that things are going quite well with efforts on both sides of the frontier, meaning that we have succeeded in maintaining the appropriate flow of medical goods in both directions, medical goods being essential, obviously, in the current crisis. This being said, we need to be vigilant because that relationship is going to be tested for the rest of the crisis. We have citizens on both sides of the borders that are anxious, that are in need of being reassured, and that's exactly what the responsibility of the federal government is to not only to provide the essential flow of those medical goods, but also to reassure Canadians that we will always be working to maintain both the relationship and the movement of those goods.
Thank you, Minister. Next question.
Our next question, notre prochaine question, is from Teresa Wright. Please go ahead. À vous la parole.
Good morning, Minister Duclos. You said that the numbers are giving us cause for cautious optimism, and Canadians are starting to see numbers in their provinces improving, and so they're naturally going to question when we can get to the new normal. So what can we tell them?
Well, first, two things. At the very broad level, yes, there is cause for cautious optimism. This being said, we need to be very mindful that the significant, considerable, and difficult efforts that Canadians have been making over the last few weeks need to be maintained. We don't want to lose what we have gained over the last few weeks with the enormous efforts of Canadians and governments. So let us be very clear. Although we want to be optimistic, we need to be absolutely cautious and maintain the clear guidance of Health Canada, Public Health Canada, and all public health officers across Canada, the absolute guidance that we need to maintain physical distancing, wash our hands regularly, avoid stay at home as much as possible, certainly avoid absolutely non-essential travel. So we really want to keep maintaining our efforts, because if we didn't do that, we would end up losing all the gains that we have acquired, that we have made over the last few weeks.
Follow-up.
Thank you. Minister Miller, you mentioned the regulatory changes that you made with regards to First Nations elections, allowing their leaders to continue in their roles for up to 6 months. But there are some Indigenous leaders who are saying this should have come sooner. Manitoba First Nation is going ahead with an election, I believe, today. How concerned are you about their safety in this voting process, and why didn't these regulation changes happen sooner?
Well, thank you, Teresa. And in regards to the First Nation that is going ahead with this election, we are working closely with them to make sure that it is done observing the strictest health protocols to ensure that everyone stays safe. It is ultimately, and if you respect self-determination, it is ultimately their decision whether to go ahead or not. You can imagine the immense sensitivity around enacting new regulations under the Indian Act, which is a colonialist instrument that is decried far and wide. And as we move beyond the Indian Act, we must recognize that there are certain First Nations that still operate under it. Enacting regulations that give First Nations the flexibility to do that, where I, as the Minister of Indigenous Services, did not have that ability, is an immensely delicate operation. It meant some level of consultation to ensure that we were getting it right. We moved as quickly as we can, and knowing the machinery of government in respect of enacting regulations and how slow that can be, I'm quite proud at how quickly they moved and the rapidity at which these regulations were put into place. And indeed, there's a mechanism within the regulations, Teresa, that allows for decisions that were taken previously to postpone to be considered valid, and therefore ensure the continuity of governance. I would not say there was a governance gap created under the current clauses of the Indian Act. There was a governance inconvenience in respect of putting power into band managers that may not want to assume the power, and the uncertainty around what leadership tools would be available to address COVID. The focus is on the health response, and so these are regulations that are of a temporary nature. They last 1 year. They expire, and then should they expire after a year, and should we need to reenact them, we will assess at that time. But they are very, very narrowly tailored, put into place, frankly, in record time to address a very important set of circumstances, namely to ensure that there is leadership continuity in face of a global pandemic, with the flexibility allowed and accorded to First Nations pursuant to their rights of self-determination. So we must respect those choices, but we'll be working hand in hand with communities to ensure that those decisions, those electoral decisions, are taken with the most information possible and in the strictest of respect of the current health protocols.
Thank you, Minister. Next question.
Our next question is from Catherine Lévesque with La Presse Canadienne.
Next question, Catherine Lévesque, La Presse Canadienne. Question. Hello, I have questions for Minister Duclos. First, a question about military medics who are being sent into long-term care facilities in Quebec as of today. The government hasn't given us much detail about where they will go. François Legault mentioned the Greater Montreal area, the Estrie region. Could you tell us where these military medics are being sent today? How many are being sent, and to which regions? Answer, Minister Duclos. Thank you for your question. I would like to thank actors in both governments who have worked hard to make this happen very, very quickly. We all recognize the urgency of this situation. The government of Quebec has a primary responsibility to handle the situation, but the federal government is also responsible for quickly stepping in to help after receiving the request that we received. 125 medically trained members of the Canadian Armed Forces will very soon be deployed in Quebec. The government of Quebec will manage their deployment. The government of Quebec will identify its needs, where the needs are on the ground. The government of Quebec will also decide what responsibilities these armed forces members will have. Thus far, what we've heard from the government of Quebec is that it is satisfied with how quickly we have stepped in to make this happen. These individuals will be sent to facilities where the needs are most pressing. Quebec will make decisions based on needs on the ground. The government of Quebec is satisfied. That said, the federal government must continue to help in any way that it can, given the importance and urgency of the situation. Follow-up question. So I'm getting the impression that you don't know where exactly the needs are most dire. And I have another question maybe you could answer on behalf of Minister Freeland. Earlier this week, there was a first minister's call with the provincial and territorial premiers, and remuneration of essential workers was discussed. Has a deal been reached with provinces regarding salary top-ups for essential workers? What decisions have been taken, and which workers will receive these top-ups? Answer. We are starting to realize in Quebec and everywhere in Canada that many essential workers are not sufficiently remunerated given how important their work is and given how difficult their working conditions are, especially in this situation. The government of Quebec may have been a bit faster in realizing this than other provinces. And another element that you mentioned is that the government of Quebec wants to help provinces and territories, and everyone wants to help essential workers. As Minister Freeland said, these talks are going well. Everyone is on the same wavelength. Now it's a matter of finding the right ways to act, the right ways for the federal government to provide financial support and salary top-ups. There are jurisdiction issues. The government of Canada, of course, wants to provide support, but must do so in such a way that respects federal, provincial, and territorial jurisdictions. And so we're continuing to discuss the issues. Thank you, Minister. And now questions in the room.
Minister Duclos, BC's success is credited with good testing and tracing, and Ontario is being seen to lag behind now. Is the federal government going to step in and mandate provinces to increase testing, and are you concerned that provinces that are lagging behind are going to pull down those that have come ahead?
You are absolutely correct in describing testing and tracing as being key actions in the COVID-19 context. We also understand that different provinces face different circumstances, and this is certainly the case in my home province in Quebec, and the federal government is always not only willing, but most often always able to provide guidance that may be helpful in the local circumstances, and provide any logistical support and any procurement support when it comes to making equipment and testing equipment available to provinces and territories. So we want to do this as much as is needed and asked by provinces and territories, and that's what we will continue to do.
And with regard to those that are on old age security or disability benefits, those that have a fixed income, what's being done for those people who might be facing mounting costs with regard to groceries or transportation or cost of living when they're on a fixed income? And is there any talk with the provinces about making sure that CERB doesn't affect their receiving of federal benefits?
Well, that's making ends meet in the current context is a large source of anxiety for many Canadians, and particularly lower income and vulnerable Canadians. That's why we acted very quickly and put into place measures that the federal government certainly never implemented and probably never envisaged, such as the Canada Emergency Response Benefit, but also increasing the GST tax credit, providing support to families with children, in particular families with lower incomes through the Canada Child Benefit. But we, and as the Prime Minister keeps saying, we are working in an emergency situation which requires continuing actions and continuing forms of support. So we are going to continue, as the Prime Minister again said, going to continue being mindful of the anxiety and the difficult circumstances which Canadians are going through, but also renewing and developing our continuing support to those Canadians.
Hi, Minister Duclos. Ashley Burke, CBC News. BC's talking about perhaps easing up some of the restrictions next month if the number of hospitalizations go down, the number of cases go down. At a federal level, what is the bar that we have to meet in order to relax some of these measures? Is it a certain number of cases? Is it a certain amount of people in hospital? Or is it, the number of tests that we were doing a day?
Thank you. Well, that's a very good question, and a very good question which Dr. Tam has answered regularly over the last few days. I don't have the same expertise and perhaps not the same credibility as Dr. Tam would have in responding to that important question. But let me summarize what she would probably say. It's around not only the curve, but of course where the curve may be heading. It's also around the capacity of the health system. It's also about the number of deaths, it's number of emergency intensive care units that are needed. And it's about the ability of workers to be protected in the environments in which they would have to work. It's about the ability of securing enough equipment under different scenarios. But since we have Dr. Wong, and since Dr. Wong is probably a lot more expert and certainly a lot more credible than I would be in that area, perhaps Dr. Wong, you would like to add your own view?
Thank you. A number of factors that we all have to actually look at. As Minister Duclos had just said, we have to actually look at, not just, the curve where it's going, but also we have to look at the local and the community and the provincial and the national picture, because depends on the interface between different factors. All of those really determine how one would consider perhaps easing some measures in one situation and not easing some measures in other situations. So, thank you.
And I'm also wondering, how many Blue Med medical tents does the department have ready to send to communities, and when exactly would that happen?
Are you speaking to Indigenous communities?
Exactly.
Not just from. I believe we have that number. We have secured additional Blue Med facility. They can be used for different solutions, whether it's isolation or testing. It depends on the needs of the community, and it's really, as we look at the pandemic plan and the possible expansion, which hasn't occurred in communities, but we have to examine and consider those possibilities. We will ramp up resources. We have a number in stock available and in the process of being deployed into communities that have asked for it and have it as part of their pandemic plan. I don't have those precise numbers, nor do I have the ones in stock. It's very much a moving variable as we ramp up capacity and as we recognize that there may be surges in communities. But it's very much something that we are assessing on the fly. But we do have a number of them prepared to be deployed and have been deployed in some circumstances. I'll let Tom answer more directly. Thanks.
With these mobile structures, we are looking forward to supporting Indigenous communities in order to expand the capacity to deal with overcrowding issues temporarily while addressing the longer-term housing challenges as well, trying to actually create a safe space in order to actually provide services such as testing, such as taking the swabs, such as isolation, as well as overflow, for temporary medical help or nursing help in the community. All of those, are part of, a comprehensive approach that we take. Thank you.
Okay, turning back to the phone, operator.
Thank you. Our next question, notre prochaine question is from Mélanie Marquis avec La Presse. Please go ahead. À vous la parole.
Mélanie Marquis, La Presse,
question. Ma question est pour M. Duclos. On parlait de
My question is for Minister
frontière, de la
Duclos.
relation plutôt largement avec les États-Unis qui allait être
You spoke about how the Canada-US relationship will be tested in the upcoming weeks.
Manifester son
When Trump expresses impatience and a strong desire to reopen the American economy, does that worry you? Well, as an economist, given the current circumstances, if we want to reopen the economy, then we must be very, very cautious, especially when it comes to public health. We have made major sacrifices these past few weeks. We have been isolated. We have felt anxious, and we have also made economic sacrifices. People have lost their jobs. People are having difficulty making ends meet. So we always have to weigh public health outcomes and economic outcomes. In the next few weeks, in the next few months, we will have to be very, very cautious. Of course, many of us are anxious to reopen the economy. That said, we must absolutely follow the recommendations of our public health experts. We must take the necessary public health measures if we want to reopen the economy. Follow-up question, Mélanie Marquis. All right, so that was your economist point of view. Now, what's your point of view as a Canadian citizen? President Trump wants people and goods moving around freely again as soon as possible. How do you feel about that? Could that compromise public health and safety here in Canada? Answer, Minister Duclos. No, I'm not worried. Our public health experts are very trustworthy here in Canada. Moreover, our municipalities, our provinces, our territories are doing such an excellent job when it comes to public health and spreading public health messages. I think we can be very proud to be Canadian right now. Our healthcare system is robust, and at some point we will reopen the economy. The federal government has a very solid financial position, so we will be able to roar back at some point. And when we want to roar back, it will be essential that all levels of government cooperate and work together, all while respecting public health measures. So when we're ready to roar back, all levels of government will work together and we will reopen the economy. Thank you, Minister.
Ceci met fin à la conférence de presse. Merci.
That concludes today's press conference.